Assistant Professor, SNS College of Pharmacy and Health Science, Coimbatore, and today we are going to discuss the topic about aspirin. From this topic we are going to see their introduction and their mechanism of action and their pharmacological action. Okay, first we see the introduction. So aspirin is a non-steroidal anti-inflammatory drug, so which is known as NSAID, and that belongs to the class of salicylate classes, so which is belonging to the salicylate classes. So aspirin, we are here the aspirin the different clinical oriented purposes, so which have the multiple therapeutic purposes, which is used as the pain relieving purposes, so which have a analgesic effect and fever reducing property, so which has an antipyretic effect and anti-inflammatory action, so which is used for the arthritis related conditions and prevent the blood clotting formation, so which also have the anti-platelet actions. So it is one of the most commonly prescribed and over-the-counter drug medication in the world. So it is the most commonly prescribed drug and it is come under the OTC category drug. Okay. So next we can see the chemical nature of the drug. So chemical nature and its structure. So aspirin is chemically known as acetyl salicylic acid. So aspirin chemical is known as chemical formula or chemically is known as acetyl salicylic acid. So the key properties of aspirin. So it is a weak organic acid. So aspirin is a weak organic acid. So slightly soluble in water. So it is slightly soluble in water and more stable in dry condition. It is more stable in the dry conditions. However, so it is more stable in dry condition, but however it is prone to hydrolysis, which undergo hydrolysis, in which condition means especially in the presence of moisture. If the environment contain more moisture, which undergo the hydrolysis. Okay. So next, mechanism of action. Aspirin work by inhibiting the enzyme called as the cyclooxygenase. So aspirin work by inhibiting the enzyme is known as cyclooxygenase, which is shortly known as COX enzyme. So there are two main type of enzyme. One is COX1 enzyme and another one is COX2 enzyme. So these enzymes are responsible for the production of prostaglandin. So prostaglandin is an enzyme. So these are the COX1 and COX2 is responsible for the production of the prostaglandin enzyme. So what is the function of prostaglandin? We want to know what is the function of prostaglandin. Then only we know the mechanism of action of aspirin. So what is prostaglandin? So prostaglandin is a chemical in the body. So prostaglandin is a chemical which present in the body, which is responsible for causing pain, promote inflammation and increase the body temperature. From these 3 points we come to know what is the mechanism of action or pharmacological action of aspirin. So the prostaglandin uses is this 3 point. So its opposite function is the uses of aspirin. So it causes pain. So the aspirin produce which inhibit the pain, so which promote inflammation. So aspirin reduce the inflammation, which increase the body temperature. So aspirin which reduce the body temperature. So how aspirin work? So aspirin irreversibly inhibit the COX enzyme. So once it bind to the COX enzyme, which it does not rebind, it's only bind strongly. So it is irreversible binding, which leads to reduce the prostaglandin synthesis. So COX enzyme are useful for the production of prostaglandin. So it's once bind with the COX enzyme, which reduce the prostaglandin synthesis and which reduce the pain and inflammation and lower the fever. So additionally, aspirin inhibiting the thromboxane A2 enzyme. So this is the major enzyme which is useful for the reduction of the platelet aggregation. So if it inhibit the prostaglandin A2, which decrease the platelet aggregations. Okay, so aspirins are which have the antiplatelet effect. So here is the mechanism of actions and how aspirin works and how antiplatelet effects are in the pictorial representation. So which bind in the COX1 and COX2 enzyme. So the COX1 enzyme is protect the stomach lining, support the platelet function and the kidney function, and COX2 which is used for mediate the pain, inflammation and fever. So it bind the COX1 and COX2 and COX1. So it is enzyme responsible for the production of prostaglandin. So what is prostaglandin? Which cause the pain, promote the inflammation, increase the body temperature, and how its work means with aspirin irreversibly bind in the COX1 and COX2. So acetylcholine amount is decreased. So antiplatelet effect, which arachidonic acid which bind with the thromboxane A2, which is responsible for the platelet aggregation. So if it bind with the arachidonic acid and thromboxane A2, the formation of platelet aggregation is inhibited. So which have the antiplatelet effect. So without aspirin, the platelet, we can see in the picture representation, we can see there is a blood clot. So with the aspirin, the blood clot can be prevented. So pharmacological action, the aspirin has various pharmacological effects, the mainly analgesic effect, so which is used to treatment of various analgesic effect, so which is used for headache, toothache and muscular pain. So even we have body pain also, many doctors can prescribe the aspirin. So antipyretic effect, which have a fever reducing property, which is reduce the fever by acting in the hypothalamus. Okay. So next one is the anti-inflammatory effect. So it is used in the inflammatory condition like the arthritis. So if we have the inflammation in the bone or joints, we can easily prescribe, the doctors can easily prescribe the aspirin. And the antiplatelet effect, we already see, which bind in the thromboxane A2, which is responsible for platelet aggregation. So it bind with the thromboxane A2 and reduce the platelet aggregation effect. So these are the pharmacological action, mechanism of action and uses of the aspirin. So I hope this video is useful for you, and future upcoming I put more videos about the various drugs. So stay connected. Thank you.